One of the more controversial topics in sports medicine right now is cardiac care in the athlete. The NCAA has started to come out with more and more of their recommended guidelines regarding the cardiac care of the athlete. This all stems from the difference in thought process with regards to how do you, through physical exam, through testing, look at what is safe for a cardiac issue in an athlete. The Europeans do it a little bit differently than we do. Almost every single athlete in Italy, for example, gets an EKG before they're allowed to participate. In the U.S., we don't do that. That's not standard of care. Standard of care is a quality physical exam alongside a quality family history, and you look at the two and you try to risk stratify athletes and say, okay, who is high risk for a cardiac issue and who is low risk for a cardiac issue? The downside with a cardiac issue in an athlete is, when it shows up, it's a detrimental issue. Nobody expects a high-level athlete to die suddenly, whether it's they have an event or they actually die from that event. It gets in the news, and it gets in the news really quickly. So for me, when it comes to the cardiac screening of athletes, the most important thing is trying to figure out, is there an underlying cardiac issue which is risky for this athlete to participate with? Some athletes have cardiac issues that are low risk that they can participate. Some athletes have cardiac issues which put them in certain categories that say these are the sports you should do and these are the sports you should stay away from. But the most important thing with every athlete is that they get an appropriate physical exam, whether it's done by their pediatrician, whether it's done by their family physician, whether it's done by a sports medicine physician, that looks at the athlete as a whole from a medical standpoint, their respiratory issues, their cardiac issues, their allergies, their medications, including their orthopedic exam. So for me, the cardiac issue is probably the most controversial issue we have in sports medicine today.